All right. Well, good afternoon, everyone. Thanks for joining us today. I'm Emily Beauregard. I'm the director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. And for all the Star Wars fans out there, may the 4th be with you. I did that for my colleague, Dustin Pugel, who is a lover of both Star Wars and dad jokes. And I think he probably has a few more to share with you today. But in all seriousness, we are excited to be hosting our 3rd forum with the Cabinet for Health and Family Services today. Our goal with these quarterly forums is to create more open dialogue between cabinet leadership, consumers, and advocates. And we really want these forums to be an opportunity for you to get the latest information on the state response to COVID-19, hear updates on our safety net programs, share feedback, ask questions. And I know that many of you are familiar with our Thrive Kentucky campaign, but for folks who might be joining us for the first time, our core purpose is to meet the basic needs of all Kentuckians through systemic change. And we do that with these shared principles that you can see on the screen. But we really believe that the only way for all Kentuckians to thrive is if we have anti-racist and anti-poverty policies in place that create a more equitable and just Commonwealth for everyone. And we'll be touching on a number of those policies today as we're talking. So these are the members of our Thrive Kentucky campaign. Many folks on this call today who are going to be leading different discussions are our Thrive Kentucky partners. This is the agenda that we're going to be covering this afternoon. We added a couple of things at the last minute there at the top, but we're going to start each section by giving our guests from the cabinet the floor to share any updates or information that they'd like advocates and consumers to know. And then we'll follow this with some discussions and questions moderated by Thrive Kentucky partners. And during each section, just be sure to put any questions or comments that you have in the chat as we're going along. We find that that works best. And we have a few questions prepared, but honestly, we want to make sure that we're getting you the most useful, valuable information. So we'd rather be answering your questions. And if we can't get to every question in the 90 minutes that we have, then we'll be sure to get written answers out to everyone. We send follow-up emails typically the next day with the recording, with the PowerPoint and any materials, and we can also make sure that we get responses to questions. So don't let the clock stop you from putting something in the chat. Before we begin, just a little bit of housekeeping. As always, we have a lot of people on the webinar, so we want to make sure that everyone can hear, so please be sure to mute yourself. We'll be recording this webinar, like I said, sending it out probably in an email tomorrow with materials, with an evaluation to let us know how this went, what topics and other information you want for future meetings. So be sure to watch for that. And if you are a certified community health worker or a licensed social worker and want to receive CEUs for today's forum, please email Kelly. Kelly can put her email in the chat for you. With that, I'm going to go ahead and get us started. Oh, that slide looks a little strange. Sorry about that. But this is information that we just put out last week. We want to make sure that everyone is aware of some new materials that we created in partnership with the cabinet to help promote the American Rescue Plan. It's really important that Kentuckians know what's in the American Rescue Plan, what direct relief is in this plan that they may be eligible for. And we want to make sure that every Kentuckian gets the relief that they're eligible for to improve their health and their economic security. There, as you can see here, there are 6 types of direct, actually I put 5 bullet points here. In the document that we created, this explainer, we've outlined 6 types of relief. With food assistance, we've broken out SNAP and PEBT separately, but there are multiple ways that Kentuckians can get direct relief through the American Rescue Plan. And this is just a significant law that has a lot of funding for Kentuckians, but it's not automatic. Most people need to initiate, some action in order to get these benefits. If people aren't, filing their taxes, they need to file their taxes to get the stimulus check and the child tax credits. If people need more affordable health insurance. They need to go shop on the marketplace, even if they've shopped in the past. The same goes for SNAP, PEBT, and housing relief. People need to make sure that they are checking whether they're eligible, even if they haven't been in the past, and then taking action. So we have lots of helpful links on this explainer. If you want to print out the explainer and hand it out in your community, you can do that. There is a simple link on the back of the explainer and a CR code that someone can just take a picture of, and that will take them to the online document with all the live links. And that should get people the information that they need. There's also an FAQ. So the link that I have on this slide will go to that. We can also drop that in the chat. And we'll be sending this out tomorrow with a file that includes some social media posts, some graphics that you can post on social media. So all of that is information for you to share. We would love your help in spreading the word. And one thing that I really want to bring attention to is that if we do this right in Kentucky, we can cut child poverty in half. We can help a whole lot of adults too, but we really have to make sure every Kentuckian is taking advantage of this. So with that, I'm going to turn it over to Jason Dunn if he is on. I haven't seen him yet.
He's here.
Are you here, Jason?
He's here.
I'm here.
Okay, great. So the next thing we're going to do is get some updates on SNAP and PEBT.
Sure. For SNAP, probably the biggest thing that we have going on right now, we early in April, and by early April, I mean April 1st, we received some updated guidance on the emergency allotments that we've been issuing every month since April of last year, I believe. So for those who don't know, during the pandemic, as long as there's a state of emergency, a state declared state of emergency, we can issue benefits all the way up to the maximum amount of benefits for a person's household size. So if somebody has some kind of income that reduced their benefits to say $50 or $100 a month for a one-person household, we could increase those all the way up to the maximum, which is now $234 per month. So, excuse me, there are households who, because they had very little or no income, were already receiving that maximum amount. So they didn't see any additional benefits during the time of the pandemic. They've been kind of left out. So the USDA on April 1st issued some guidance for the April emergency allotments that says that everybody needs to get at least $95 in an emergency allotment. So if you were somebody who got $50 in SNAP benefits, and then you got $184 to take you up to the maximum benefit, you wouldn't receive any more than that. But if you were someone who is already receiving $234 a month, you would get $95 in an emergency allotment benefit. So we've started taking those actions to change our systems. Our systems are not that fast to change, unfortunately. Once the programming is in place, we'll make sure anybody who's received less than $95 in additional benefits will receive a supplement to bring them up to that, and it will go back to April, to the month of April, once we get those caught up. So. And as long as we're able to still issue those emergency allotments, we'll have that programming in place to do at least $95 per month for each household. So that's an important piece. We'll have that in place early June, I understand from our system folks. So we'll have that in place then. For PEBT, we have issued all the way through April benefits, I believe. I think we're all caught up on the issuances that we've sent out. For October through February, at least, the range of benefits that we've issued has been between $55 million and $75 million, just depending on what schools were reporting was their predominant method of instruction during those months. So you can kind of see as the impact of COVID has increased and decreased, the benefits will change throughout that time period. I think right now, our April benefit is somewhere closer to the $40 million range. So as schools are back in session more and more, you'll see fewer PEBT benefits issued. The two new items that we're waiting for some approval on, one we're waiting for approval on, one we just learned about last week, so we'll find out more about that. We will have PEBT available for children in daycare, ages 0 to 6. This will only cover SNAP eligible children who are age 0 to 6. And the eligibility for this benefit is enrolled in daycare. And thankfully, because enrollment is such a hard number to identify, the federal government has decided that anyone receiving SNAP age 0 to 6 is going to be deemed automatically enrolled in childcare. And they also have to be living in an area where a school district has been impacted by COVID-19. So they've had to adjust their schedule because of COVID-19. That should be almost all of the state of Kentucky. So we'll be able to issue those benefits going back to October for that age group. So that will be significant, and that'll go directly onto the SNAP EBT cards for those children. The latest update that we've received is that we will now have a summer PEBT program. It seems like the assumptions get easier as we go along from the federal government. Thankfully, it's going to include any student who was going to a school that was impacted by COVID-19 during the school year, which is, again, almost all schools. That is going to be a $375 benefit per student that's to cover the entire month, June through August. We're gathering information from our federal partners right now on what needs to be included in that request, but it seems like it should be fairly simple. I say that knowing that there's nothing that's ever simple. Every time we think this is simple, it's not. So I'm going to open my chat so I can start seeing some questions, but we'll start doing that soon. PEBT benefits, I go backwards on these questions. So I'm looking at Liz's question right now. Are PEBT benefits regardless of income or for families receiving other benefits? Good question. PEBT is for any student that is receiving free or reduced price meals at school through the National School Lunch Program. So there are 3 ways you can be eligible for the National School Lunch Program. Either you fill out the form at school to show that you're income eligible, or you're directly certified because you receive some other kind of benefit like Medicaid or SNAP or our cash assistance from our cash assistance program, or if you attend a school that is what's called community eligible provision school. That means you have a high enough percentage of eligible free and reduced lunch program students that the entire school is eligible, and every child in that school would be eligible for it regardless of their income. So in some cases, it depends on your income. In some cases, it depends what school you go to and whether that's a what we call a CEP school or not. Just to give you an example, in Franklin County, in the Franklin County school system, every school other than the high schools is a community eligible provision school. So everybody in middle and elementary school, every student is eligible for PEBT. For the high schools, only the students who are deemed eligible for the National School Lunch Program will receive PEBT, and the other students will not. So, and Kara has probably encapsulated that in far fewer words than I did just now. So are there other ones that I've missed?
Jason, I saw one question.
Go ahead, Emily.
I just saw one question about kinship care, communicating specifically with kinship families.
Okay, I'm trying to find it, I'm sorry. Are we talking about kinship families? Oh, how are we communicating with kinship care parents? Our communication should be, you know, that the students are eligible based on where they reside and where they go to school right now. So, you know, the communication should be the same whether a student is with their parents or if they're with another caregiver relative or any other kind of placement. So the benefit should go to wherever the child resides. So hopefully those addresses are correct with the school system, because we're using the school system's addresses primarily to provide these benefits, unless they're already known to us because of another type of assistance. So they should be able to get those benefits regardless of where they're residing or who they're residing with. I hope that helps. Corinna did show in here that you can request a new card by calling the 888 number. That is for our EBT vendor. That will work if you don't have a change of address. You can use that number to request a new card. If there is a change of address that we'll have to enter in our system, you'll have to call DCBS, and I will put that number in the chat as well.
Thanks, Jason. And I also linked the explainer again because that has information about PEBT on there too.
Right. Correct.
All right. Well, thank you, Jason, for those updates. We really appreciate it.
No, thank you.
If people continue to have, want to put questions in the chat, we can answer those in the chat or follow up with written questions and answers. But for now, I'm going to turn it over to Kara to give us some updates or to start the conversation on the 2021 General Assembly.
So believe it or not, the legislative session ended almost a month ago, and it is now, of course, May 4th. And we have some emergency laws that have the E beside them that are already in effect, and then we've got some that haven't gone into effect yet, but there was quite a few that directly affect CHFS. And I know that CHFS has been working on preparing what changes have to be ready to implement laws that were passed in the 2021 General Assembly, especially, Senate Bill 55, eliminating copays. And then I'm hopeful, I'm going to turn it over to them to see what they want to share with us, and then we'll follow up and see what questions folks have.
So, hello, yes, we are definitely very busy implementing legislation from 2021. One of the biggest pieces of legislation, however, that we've been focused on is Senate Bill 50 from 2020. We contracted with MedImpact in January to serve as the single pharmacy benefit manager for all of our managed care organizations. So we have been working very diligently to implement that effective July 1st, 2021. We have had several meetings, including meetings related to our IT, our infrastructure, to make sure that we get this right. Our formulary, our pharmacy formulary is going to be aligned across all MCOs. So every provider will be able to know which drug is covered. We continue to have the single preferred drug list that all MCOs will be using. Providers will have one VIN number and one PCN group number rather than the 6 different ones that they have in order to bill and file claims, which is going to make it a lot easier for them. Of course, we do have pricing transparency now because the department is actually setting the rates for our pharmacy program, and we will have one dispensing fee, which is aligned across MCOs, which is $10.64. The MCOs, of course, are going to continue to monitor and manage the medical benefit side of those pharmaceuticals. So, for example, those drugs that are administered in provider offices rather than dispensed at the pharmacy will be managed by MCOs. We are also working, we have several webinars for our providers. We're focused on current prior authorizations to ensure that there's no interruption of services for our members. We're going to have a 90-day no questions asked extension on prior authorizations to allow us time to update medications in the event that some of those medications may not be on our preferred drug list. But our primary goal is, of course, focus on the member and their need and ensuring that there are no disruption of services. We are also working to develop a common listing of over-the-counter medications, because as you can imagine, having 6 MCOs, they do have a different list of over-the-counter medications that they use. So we're aligning those medications. We're also preparing member and provider communications so that we can get that out prior to the change on July the 1st. And we do have a state plan amendment pending with CMS. However, we have been talking to them throughout this process. They have asked a few questions, but we don't anticipate any issues with that SPA approval. Another piece of legislation that we're very excited about, of course, is Senate Bill 55, which eliminated co-payments. If you remember, prior to Senate Bill 55, we had drafted a regulation to align with a statute so that our co-payments were in compliance with their state law, and that had a $1 co-payment in that. So we now have to do a state plan amendment and a regulation change. However, because of the public health emergency, co-pays are still suspended. So we're working with the MCOs and in-house in Medicaid to make sure that we have a member communication and a provider communication that ensures that everyone knows that going forth that there are no co-pays for Medicaid members even after the public health emergency ends. We're working on House Bill 497, which is the Medicaid enrollment pre-release. We believe that the provision in that legislation is actually covered under our substance use disorder waiver that we have submitted to CMS, which is still pending, that will allow us to cover substance use disorder services for individuals who are incarcerated 30 days prior to. And then we're also working on House Joint Resolution 57, which is, again, a very exciting piece of legislation, because that forms a work group to study the feasibility of implementing like a bridge health plan for those individuals who maybe don't qualify for Medicaid, but yet can't really move to the exchange. There's a few other things in the legislation that we have to do. But we are very excited about that, because that will give us the opportunity to explore having a full continuum of care for individuals for insurance. If they, like, for example, if they fall off of Medicaid, and I go back to my, $1 is all it takes for an individual not to qualify for Medicaid because of that poverty scale. So sometimes it's difficult for them to move from Medicaid and onto the exchange, depending on the amount of advanced payment tax credit they get. So there would be that little bridge payment or that bridge plan in between. We have mailed all the attendees that are listed in House Joint Resolution 57. We've gotten some names of almost everyone. We're waiting on just a few little things. And then our first meeting is supposed to be in July. And the work group will cease to exist in December after we develop a report for the governor and the legislative body. So again, very, very excited about some of this legislation that offers us opportunities to improve and expand on the services that are so vital to the population that we serve.
Thank you, Commissioner Lee. There's a lot going on, and you just hit us with a lot of information very quickly. I have a follow-up question. There's a follow-up question in the chat about House Bill 497. With House Bill 497, all Medicaid eligible individuals, can you see it in there, be enrolled to release, not just those with substance use disorder from the waiver?
I think right now, because of the way our waiver is worded, it's only going to be those with substance use disorder. It's not going to be all Medicaid eligible individuals, only those with substance use disorder who need substance use disorder.
Is there, to continue to follow up on that same bill, is there a plan I know you can't know the timeline for approval or non-approval with CMS, but if that waiver is not approved by CMS, what's the plan for implementation for 497?
Well, if it's not approved by CMS, I mean, 497 just requires the department to, the language in 497 is very specific to Medicaid, and it just says, in the event that the cabinet seeks and receives approval, that we will make that coverage for those individuals a priority. So if it's not approved, I think we would be back to square one, and we'd have to try to develop some other sort of plan to engage and enroll those individuals.
We also had another question back to the 2020 Senate Bill 50 single PBM. If someone wants to appeal a pharmacy decision, will it be through their MCO or does their new pharmacy provider?
I'll double check on that, but I believe that if they want to appeal, that it will come to the department, since we are overseeing, we have the contract with the pharmacy benefit manager. We actually have that contract. The MCOs also have a contract, but it's the identical contract. But I believe that it will come back to the department if they appeal that decision.
Thank you. I was trying to think if there was
about the diabetic.
Yeah, the diabetic patients won't have to change testing strips and learn new so often. Yeah, I believe that that's true. There will be fewer formulary changes, since we're only going to have the one. The department controls that formulary, and the MCOs just have to abide by our directions, what we state in the contract.
And then I promise this is my last one. We'll see if anything else pops in the chat. But one more, go back to 497 with the removal of the SNAP TNF drug felony ban. That would be separate from that pre-release waiver. Do we know what the timeline is for that implementation?
I submitted a change request for our systems the day after this bill was signed. So it's effective. All legislation without an emergency clause is effective at the end of June. So our expectation is this will be in place, if not at least disabled in our system on July 1st. And anyone who has a disqualification right now, those will all be wiped away. So, if there are people who are still receiving benefits, and one individual is disqualified, we'll add them back to the case. Others who have been denied or disqualified and are not receiving benefits right now are free to reapply, and assuming that all other eligibility criteria is met, they'll be eligible. They won't have that disqualification anymore. We're so happy for that.
That's fantastic. Thank you, Jason. And thanks for being snappy with that. I know that's something you've worked on before, so appreciate it. Yeah. We also had a question just to see in general about the current 1115 waiver, if there is any sort of a status update.
We have been having communications and meetings with CMS. They had a few questions. We have another meeting scheduled with them at the end of this month, but the waiver is still pending, but we're still in communication with CMS.
All right, well, I'll reserve my right to come back and think of something else. I'm just kidding. You're free from me. We will move over to the federal relief and state budget impacts, unless there's anything else that Carrie Banahan or Commissioner Lee or whoever else is there would like to share.
I think Eric Lauer is going to provide the update.
All right. I think Kara reserves the balance of her time. And in the meantime, I will go ahead and get us kicked off with some of the funding updates. So, I think the ARPA explainer, and ARPA is our shorthand for the American Rescue Plan Act. For those of you who are wondering why I'm using this weird word. Our explainer does, I think, a good job talking about a lot of the direct assistance that folks are going to get. But on top of that, there really was a pretty breathtaking scope of funding that was provided to states and to directly to other entities like cities and schools that really, I think, meets the moment that we're in of this pandemic crisis and our economic crisis. And so, you know, that in Kentucky means that we are going to receive something like $764 million for childcare, almost $100 million for home and community-based services. There's $7.7 billion nationally allocated toward expanding the public health workforce. So we're really excited about what that means for Kentuckians and the ways that we might be able to use that. But then we also had a state budget that sort of on the opposite end, just more or less continued where we were before in anticipation of needing to put that money into the rainy day fund, the extra money that we were anticipating from last year. So all that being said, we wanted to give the cabinet some time to talk a little bit about how they anticipate being able to use some of the ARPA money and what the current state budget situation is going to mean for the next year. And then of course, you know, all bets are off next year when the legislature will come together and write their third budget in 3 years, which is really pretty unheard of in Kentucky. We usually have a biennial budget. So with that, I guess I'll hand it off to Eric. I guess you're going to be answering or presenting on some of that, and then we'll go from there.
Thank you. Thank you for having me today. House Bill 192 passed in the waning days of the General Assembly. For our cabinet, it reaffirmed our current year budget of $17.7 billion and set a budget for fiscal year 22 of 17.8. There were some things included. A lot of the budget resembled the governor's recommended in a lot of ways. We did receive funding for the HRIP program, which would basically switch our Medicaid reimbursement from a upper payment limit to an average commercial rate. There was $29 a day add-on for nursing facilities for this year during the pandemic. There was additional money for frisky centers and for early childhood adoption foster care supports. We're very excited about these things. As with any budget, we don't get everything we asked for. Some things that we did not get included Michelle P. and SEL waiver slots. We did not receive money for social workers or some additional funds that the governor wanted to provide to the local health departments. So it wasn't a perfect budget, but with the state of the general fund, we're not looking at any budget cuts at this time, which we're very thankful for. There was also another appropriation bill, House Bill 405, that provided $20 million to DCBS for prevention services and another $12 million to DCBS for a $2 rate increase on their CCAP reimbursements, Child Care Assistance Program. So these were good things. At a federal level, from looking at the funds, so far we have received just a handful of the grants that we're anticipating receiving. All told, we are anticipating receiving a little over $900 million from the American Rescue Plan. A lot of money, as Dustin mentioned, for child care, over $700 million for child care. There was money for senior services, for WAHI, for Tanf, child abuse prevention, mental health services, substance abuse. A lot of good things, a lot of things that will hopefully impact a lot of people across the Commonwealth. So we are anticipating more grant awards coming forward in the next few weeks. I know that our departments are working towards developing plans on how these dollars are going to be spent and working with their contracted partners in order to implement these funds. But that's the update I have. I would open it up to any questions anyone might have.
Well, you sort of answered one of my questions, which was essentially, you know, are there any plans set yet for how to spend the child care money or the TANF money or the Hcbs increase? I guess those are still being developed at this point.
From what I understand, I'm not sure where they are in the approval process of these plans, but they're in process.
And Dustin, this is Lisa. And so with the Hcbs funds, we have received several recommendations and input from other individuals. We're looking at all of the recommendations that we received. We're going to schedule an internal meeting because of those, the Hcbs funds. We do work with behavioral health, and we work for the Department for Aging and Independent Living, and we believe that needs to be a group decision effort when we look at that funding and where we can best spend those dollars. We have had some recommendations on adding slots to waivers. We're a little bit concerned because this is a one-time funding, and so we want to be really careful that we don't build something that's going to need continuous funding after the 10% funds are expired. So again, we're still working on all of those things, and we definitely don't want to leave this money on the table. So as on the next Thrive, we'd be more than happy to give some updates on some of the things that we're either looking at or what we want. Some of the recommendations, for example, have been expanding broadband, but we want to make sure if there's another initiative that we're not duplicating anything else that's going on out within the state. But some of the good suggestions I think that have come up are definitely sign-on bonuses for employees to bring in new employees to expand the workforce. So that one-time sign-on bonus would be something that I think that we definitely want to look at. And I'm not sure, Emily, if that was in one of your recommendations or not, but we did look at your recommendations, and that was something that we thought could actually, we've heard that from two different sources, but that's something that sounds like it's doable too. So those are some of the things we're looking at. We are looking at all the recommendations that come to the department.
Well, you guys have the cabinet in general has a big task ahead of you, because all these different funding sources have different dates by which they have to be allocated, and then when they need to be spent. And the Hcbs one in particular is a very tight timetable.
Yes.
It's only good for a year. It's not clear yet if it has to be spent within a year or if it's only a year's worth of an increase in the federal share of spending for home and community-based services. But I don't envy your all's decision-making that has to be done pretty quickly here.
We're getting some of those clarifications from CMS. We are waiting on a clarification related to, that funding stream. And,
Right.
We have a year to spend it, but, is it, how does all that work? So we're waiting on a few clarifications from them.
That's great.
I would add that some of our funding streams only have a year. Some of them have 3 years that we can spend the dollars. So it's a different situation for each program.
Yeah, I think childcare, the bucket split in two ways. One has 2 years and the other one has 3. That's right. Yeah, there's a lot of opportunities in the next few years for that. So any other final thoughts or questions from folks before we move on to health equity? Marcy's going to take that one. All right, Marcy, take it away.
Thanks, Dustin. I'm the Executive Director of Mental Health America of Kentucky, in case some of you haven't met me before. So thanks for being on. All the Thrive Kentucky partners have committed to addressing health inequities in the Commonwealth. There are many reasons for Kentucky's health inequities, of course, and it's important each be addressed. We knew that. In early 2020, Governor Beshear made a commitment to improving health equity in the Commonwealth. That's a big undertaking. It's not an easy thing to promise, is to try to start addressing that. We'd like to invite Vivian Leslie Bibbs to share an update on what the cabinet is doing so far in health equity. And I'm sure we'll have some questions.
Good afternoon, everyone. Pleasure to be with you guys to kind of share what health equity is looking like, not only in the cabinet, but in the Department for Public Health, as well as I sit as director of the Office of Health Equity for DPH. So just some things to highlight, and I'm going to be kind of focusing on what was on the agenda that was sent to me, talking about what internal policies, trainings, and other activities that we're proposing to address health inequities that impact our populations. So one of the things that I'm sure you all are familiar with is the Secretary Friedlander's initiatives of addressing not only health equity, but racial equity as one of the pillars that he's putting forth to the cabinet to ensure thriving Kentucky resilient populations, right? Doing whatever we can to address whatever those barriers and challenges are that are keeping them from having optimal health. So that racial equity emphasis is being driven by Rashad Abdurrahman, which is looking at how equity through policy, through procedures, through programming, how some of those are impacting those barriers and challenges and those racial inequities. If they can be highlighted, what can we do to change those? What can we do to make sure that we're doing the best we can and being the most diligent from a workforce perspective to address some of those initiatives? So that work is going on. I know that there are different departments that are ahead of others as taking a deeper dive into that, as coming up with projects within their branches, within their departments, looking at their internal infrastructure and how their workflow is generated and how those that are hired can address some of those barriers and challenges that have been recognized. And that also has kind of bled over into the Department for Public Health, which we're leading a kind of a year's journey through racial equity by offering staff an opportunity to plug in different ways, whether that's through a curriculum facilitator driven approach, whether that's selecting something a la carte to build your own study on addressing health inequities and racial inequities, or whether you participate in some of the other activities, which is our movie clubs, our book clubs, our conversations around equity. And many times we have folks along that continuum of, are they ready to talk about equity? Are they ready to talk about racial inequities? Which I think COVID-19 has given us an opportunity to address those. Everybody wants to talk about equity now. And we want to make sure we're having the right conversations around equity and that everybody understands what we mean when we say racial equity, health equity. So both the Department for Public Health and the Cabinet are having those conversations, which I think are healthy conversations and long overdue. And I'm excited about the work that's going to be coming out of that. Our commissioner's been very supportive, as has the secretary, as we develop these phases. We're in phase 1. We plan on having going to 3 phases and extending this through 2022. So I'd love to come back and share with you what the results of that journey has been for us and where we are as a department and a cabinet. Some of the other things, of course, that show inequities within our state in a tangible way is the Minority Health Status Report, which is a biennial report that is mandated by statute that we produce. Now, the pandemic kind of threw us up on our head as it relates to getting that out in a timely manner, but we are working with across the cabinet with data analysts to pull that together now to do a 2019-2020 kind of executive summary and then do an in-depth detailed 2021 report. So we're in the process of generating those now that we have some help in the office. We're also acquiring some help through some of the COVID-19 equity funding to supplement the office to really get some things off of our plate and rolling, since COVID has allowed us an opportunity to not only address some of those initiatives around community health workers and some chronic disease issues impacting populations, but also what policies and what other access barriers, whether it be transportation, et cetera, are impacting populations. Also, I'm proud to say that I was kind of, I want to say I had some input and was instrumental in the health equity TAC that was established by executive order by the governor in November of 2020, which is really looking at internal policies and procedures around our Kentucky Medicaid program. And are we meeting the needs of that population based on race, ethnicity, gender, language spoken, primary language spoken, disability, sexual orientation, and SES. And there are several things we want to make sure that this TAC does. It wants to recognize whether there are barriers, whether there's policies or systems in place that are impacting the health of certain populations. Are we collecting the right data? Are we able to say with certainty based on what we're collecting, whether we can show that we are impacting the health of our most vulnerable? We want to understand and address populations and where they are. You know, sometimes we often think that we make certain assumptions that we are knowing the best how to serve populations without really hearing from them, the folks that have the lived experience. So we want to make sure that we're hearing that voice. So the composition of this TAC will make sure that it encompasses not only academics, not only people from different departments, but also those with lived experience, those that can provide valuable feedback as to some of the things and challenges that they may have been facing as a recipient. Then we're going to talk about quality indicators that may help us address some health outcomes that are impacted by the social determinants of health, where we live, where we learn, where we work, where we play, and the factors that can influence them. And then we want to make sure that based on all of that, we have actionable steps to improve the implementation of access to care, make sure that we have actionable steps that may address any gaps or service deficiencies. And then of course, we want to have something to report out to show that yes, this was a functioning, actionable group that actually had recommendations to move forward out of this group. And then I can't say enough, being an epidemiologist by training, how important race ethnicity data is. It kind of brings me back to those reports that we generate, that if we don't have some data, those minimum data elements, we can't paint that picture. We can't inform our communities. We can't inform our programs. We can't inform our grant, those that give us grant funds, that we need a specific amount to do this, a specific work in a particular community. Because in my world, if there's data not to support it, it doesn't exist. So I think we need to really enforce those minimum data elements of race, ethnicity, age, gender, primary language spoken, and disability status as those 5 minimum data elements that we all need to do our work. So I have rattled on long enough. I know Emily knows I can talk, so I see her smiling at me. So I think it's my time to.
No, that was great. Thank you very much.
Let you guys
comprehensive.
Ask questions.
Yeah, no, that was great and comprehensive. One of the things we say in mental health, the behavioral health TAC over and over again is we can't fix what we don't know is broken, right? So I'm with you on that data piece 100%. Yeah. Is there any way that we can help you with that data collection message, getting that out there, or anything advocates can do to help with this process?
Yes, absolutely. When you have a person's ear that can make those decisions, that's what could be mandated, what could be, enforced to make sure that we're collecting those. Please tell them that the struggle is real. And I don't want to, throw the jargon around, but it's hard to paint a picture and to say things about specific populations when the numbers aren't there. And we know anecdotally what's going on in communities. And I think that's important for us to be able to show that. And we know how those that make decisions want to see either the economic impact or how that number that's showing that disparity. So both of those are important to us. I will say that we're adding new things to the Minority Health Status Report that I hope people will still continue to find interesting, which is maybe looking at the health benefit of addressing equity and the impact that it's having on populations. Can we put a dollar sign to addressing inequities in our state? Can we really give that a number? We give chronic disease numbers. We say if we address diabetes and we do DPP or we do the DSME program, we're saving our healthcare system X amount of dollars. Why can't we say that about addressing health equity or addressing equity and inequities within our systems, right? So I'm hoping to have something like that to show up this time in the Minority Health Status Report, along with some information about our substance use disorder program and behavioral health, when we want to incorporate more mental health into the Minority Health Status Report, because I think that's an issue we often overlook, not only with our minority populations, but just our other populations in general, because mental health crosses all of those. It's just not fixed in one demographic. So we want to start saying more about mental health. And we also want to say something about our populations that have intellectual or physical disabilities. So we're including a section that the Human Development Institute at UK is providing data for us, because they often remind us that we have some of these issues too, and we're often overlooked and put on the periphery, and we're very marginalized. So we want to be more inclusive in our reports moving forward. And I'm always looking for ways to do that. So I'm always open to suggestions. If any of you all have ways that we can put, keeping the Minority Health Status Report condensed, I don't want it to become a a large, huge document nobody reads. But if you have ideas of what you'd like to see included in the report, please let me know, because we're always looking for ways to keep that fresh and make people want to go to that report. So.
Dustin makes the comment, he'll read every word. He's right. And I probably will too, at least the behavioral health and disability aspects. So
very good.
Do you have any idea when that might be coming out at some point? Any kind of ballpark for it yet?
Yeah, we met today. Our plan is to start working on this and have something for internal review at the probably August, and then have that to come up to the secretary for review in between August, late August and early October, and then back over to DPH and my shop for final edits. And then when first of the year, have that go to the LRC, because they're the ones that really are supposed to be first lookers at that report. So, and then we put that up on our webpage, and then we also send that to our community partners. And then of course it's available upon request, so.
Does that answer your question, Emily, too, then?
Yeah, that was great, thank you.
Yep, thank you all so much. There was a question about non-emergency medical transportation and health equity. I understand that you guys are working on something related to that. Is that true?
Oh, well, yeah. So we just had an opportunity. It was a non-competitive vaccine health equity grant that CDC was providing. It was 108 awards out to multiple states, and Kentucky was given an amount that we were to be awarded based on an algorithm that CDC came up with based on our population, our social vulnerability index. I won't bore you with that, but so we were given an award amount with a rural carve out. And within that, we proposed to address the transportation issues, non-medical transportation issues for those that are part of the Medicaid program, where that transportation can be to clothing banks, to food banks, to things that are non-medical. And we know that that's needed. So we're hoping that we can put that infrastructure in place and sustain it past the 24 months. That's the key, past the 24 months of the life of the grant. So we're looking forward to doing that. We're also looking forward, just to give you a high level of what we've put into that grant. I won't share anything because you always have to wait on CDC to approve those and not have any revisions they want us to make. But we have put in there to expand telehealth in our rural communities. I know the governor has also talked heavily about doing some of that, and some of that work's been done in our rural communities and in our urban communities in Louisville as well. So we're looking to expand telehealth, and we've proposed some hotspots be set up in Eastern Kentucky so our seniors can do some telehealth and some other things that are needed as it relates to mental health with our children in our schools, with our Friskies. So we're addressing that conversation with telehealth. We're also looking at expanding our community health workers across the state, putting them more not just in Eastern Kentucky, but in Western Kentucky and across our states as well. We're looking at building out our data management system to where we can have a health equity dashboard. We've been looking at other states and what their public-facing dashboards as to what people can come and look and see where those gaps are, see what we're doing as it relates to equity, what some of the social determinants are. So we've got a lot of good ideas proposed. I might be calling on you, some of you that I see faces on here, to help us implement some of those things, but we're very excited about that, getting that money into the state to really do some tangible things related to equity. This is the first time since I've been hired that I've seen this much money come into the state related to equity. So I'm hoping that we're good stewards of that money, and that we do what we need to do to make sure we close not only our health disparity gaps, but address some of those upstream things that are impacting those gaps, right? Some of those social determinants, some of those structural and institutional things, some of those policies. I could go on, but that's basically the 30,000-foot view of what we've proposed.
No, that sounds amazing. That's all I have right now. I'm not seeing any other questions in the chat. If I missed anyone, let me know. But I think it's time to hand it over to Priscilla for discussing the special enrollment period and Connect Reboot.
Thank you, Marcy. It's actually going to be me today because
sorry.
Unfortunately I had an accident. She's doing fine, but it's just been one of those weeks for a lot of people. So yeah, I think that there's a lot of exciting news about the special enrollment period and the marketplace just generally, Connect coming back. If folks haven't heard, we are in an extended special enrollment period on healthcare.gov. Kentucky actually is still using that platform for now until this fall for individuals to shop and enroll in marketplace plans. But this is really a special enrollment period that we've never really seen before in terms of the length of time that people have to shop and the bigger savings that more Kentuckians will see. And so I'm really excited to have Deputy Secretary Carrie Banahan joining us to tell us more about the special enrollment period, what Kentuckians can expect to see this year and next year in terms of savings, and any updates, Carrie, that you can share related to reconnecting. And I always say that with KYNECT. And also reintegrating our state-based marketplace for open enrollment this fall. So I'll turn it to you.
Well, thank you very much. So the American Rescue Plan provided for increased premium tax credit for individuals who purchased exchange plans. So individuals that have income up to 150% of the federal poverty level are now eligible for a zero-cost plan. And overall, individuals can save about $50 on their premium amounts. The American Rescue Plan also eliminated that upper income level of 400% of the federal poverty level for individuals to qualify for a tax credit. It was, maxed out at 400%, and individuals were required to pay no more than 9.83% of their income for a premium amount. So that was decreased to 8.5%. So here in Kentucky, we have over 30,000 individuals that have income over 400% of the federal poverty level who could potentially now qualify for some type of tax credit to purchase their health insurance. We do plan on doing some mailers out to individuals, advising them about the tax credit and the special enrollment period. It began April 1st and will end the end of August. This week, we identified those individuals that had denied Medicaid coverage as well as denied presumptive eligibility coverage. There were around 11,000 individuals beginning January 1st through the end of March. Sent out a mailer to them, advising them of the special enrollment period, how to enroll and how to apply for coverage. We'll also be sending out another mailer the middle of May for those folks that were denied Medicaid eligibility due to income, as well as presumptive eligibility. Under the American Rescue Plan, there's also a provision, and we are waiting guidance from CMS. It's supposed to come out sometime in June. So for those individuals that received one UI check in 2021, they're also eligible for a zero-cost silver plan on the exchange through the end of December. And we have entered into a memorandum of agreement with the Office of Unemployment Insurance to identify those individuals, and we'll be sending them out a mailer as well as emails advising them of this enrollment opportunity. There's also a provision under the American Rescue Plan that we're not really directly involved in regarding COBRA. So if you actually had COBRA coverage from April through the end of September, the federal government will reimburse you for that at 100% of the premium amount. So that's a pretty good deal, you know. So any questions?
Yeah, thank you, Carrie. I really don't think we can overstate what a big deal this is. And for Kentuckians who are eligible, this could just mean hundreds of dollars in savings a month. In fact, we've heard stories from Kentuckians already who have gone and shopped and been able to get a plan that was $200 or $300 less a month. I expect to hear a lot more of those stories, but the truth of the matter is a lot of people just don't know or assume that this is not something that they're eligible for, especially people with higher incomes. So everyone on this call, I just really encourage you to let people know that things are different this time. If people have shopped on the marketplace before and been discouraged because the rates were too high, they really should shop again. Carrie, you had mentioned
these income tax credits are only good through 2022, but under President Biden's American Family Plan, they're hoping to make that permanent, which would be, you know, a huge here in Kentucky and in other states. So sorry I interrupted. Go ahead, Emily.
Oh, no, I was just going to say, you had mentioned some of the targeted outreach that you're doing. Is there any specific outreach that you're planning for people above 400% of the federal poverty level?
Yes, there are. We're working with one of our vendors to send out a mailer to those individuals, you know, targeting zip codes and different income levels. So we do plan to do some outreach to those individuals.
Okay. And do you have like a timeline for that? Is that something, I know this enrollment period does go through August 15th.
Right. So for those folks with the higher income limit, it's probably going to be maybe the end of May or June. You know, we're working through that right now.
Okay.
The UI notice, the letter, that outreach will happen sometime in June. And one thing I wanted to mention too is with the federal exchange, individuals actually have to, you know, sign on to healthcare.gov. You have to go into your account and update it to receive the increased tax credits. If you don't, you won't receive that credit till you file your taxes, you know, in 2022 for 2021. So I know healthcare.gov, that they've been emailing individuals, they've been sending out notices. Our two insurers on the federal exchange right now, Anthem and CureSource, they're also conducting outreach to their members saying, go on healthcare.gov, update your application, see if you're eligible for an increased tax credit.
And I know that there are a lot of Kentuckians now. I mean, I would say at least 20 or 30,000 that I'm aware of who have what we sometimes refer to as a junk plan, but it is a plan that does not meet the ACA essential health benefits and doesn't have—
There's short-term plans, limited duration. They impose pre-existing conditions. They have, you know, annual limits. So yes.
These are plans that, you know, typically people either don't realize what they're buying, or perhaps they've shopped on healthcare.gov, found it unaffordable, and went with a lower premium plan, not realizing that, you know, it had a lot of holes in it. So there's, of course, there's a train in the background. I was just wondering if there was any specific outreach happening for those individuals.
We're not doing any specific outreach, you know, to those individuals, you know, other than maybe that they might see advertisements, you know, on TV, some of our social media posts.
How would we identify those individuals, Emily? Do you know how we could identify those?
You know, I think only through insurers.
Only the insurance companies can. I mean, you know, the Department of Insurance, they know who sells the short-term plans, the limited duration plans, you know, so they have that information. You know, what happens a lot of times is people will go on the internet and Google for health insurance and not realize that it is, you know, one of those junk plans where they do impose pre-existing conditions or there's limited benefits, and they don't become aware of that until they actually use it, you know, and then they find out, you know, that it won't cover their cancer, you know, won't cover their healthcare conditions. So I think what's needed there is more transparency, you know. So, you know, maybe working with the Department of Insurance, we could maybe have more transparency with the insurance companies so people know exactly what they're buying.
Yes, absolutely. And, you know, it's also a matter of word of mouth. So if you know people who have one of those junk plans or short term, long duration, I always get that acronym.
Limited duration, yeah.
Limited duration. Yes, I did it again, Dustin. So if you know someone who has that, my brother-in-law bought one without me knowing it. You know, it's pretty common. It's good to let them know that there are new options on the marketplace. Some other questions that we had, Carrie, were just about the Connect reboot. And, you know, I think for many of us who have been part of, you know, the original development of Connect and getting things going with outreach and enrollment in 2013 and 2014, people who are connectors on the ground, we know a lot about, you know, what it means to have an integrated state-based marketplace. I think not everyone is probably really aware of just what the difference is, what's going to be different than healthcare.gov, what that integration really means for Kentuckians. Can you give us a refresher?
So with Connect, you know, when it's launched on November 1st, individuals will have one place to apply for healthcare coverage. It will be a one-stop shop. It's a single streamlined application process. So, you know, the parents could be eligible for a subsidy, you know, through the exchange, and the children could be eligible for CHFS. Now they'll just apply in one place, you know, they'll have, you know, one organization to send the information to, that they'll have one research period, you know, just making it a lot simpler for families. So right now on the federal exchange, we have account transfers. So, you know, if you go on the exchange and then, oh no, your kids are eligible for Medicaid coverage, it sends the file back to Kentucky, and then they have to get in touch with the family to have them apply for coverage, you know, here in Kentucky. So this is going to make it a lot easier for families to apply for coverage. So probably increase enrollment, in my opinion, as well.
Yeah, I would suspect so, especially because at least when we had Connect, you know, originally the time it took to enroll, and Kara can speak to this, it's probably half the time, maybe a third of the time it takes people typically on healthcare.gov. So it is a much more streamlined, sort of easy process to navigate, and doesn't have those delays if you do end up, you know, starting an application on healthcare.gov now and it turns out you're Medicaid eligible. Those delays and with that transfer process can mean that people don't have coverage for a number of weeks. I don't know, Kara, if you have anything you want to add to that.
Oh, just that it was nearly unavoidable for some people. There was nothing you could do about it. And so that's why I'm so excited and want to build up the excitement and expectation of having that one-stop streamline, one application for whole families, because lots of families do need different kinds of coverage. And it is so much harder to explain that and get that word out. So I'm excited, and thank you to keep building for that expectation of it being easier. There being better options and it being easier. And there was a question in the chat about more providers. Are you all able to share any insights about?
So we have 2 new insurers to the Kentucky market that hopefully we'll be announcing in a couple of weeks. So
that's very exciting. We've had 2 insurers for a number of years now. So having additional means more competition and more choice. So we'll be sure to spread the word whenever that information comes out. It looks like Tyler has a question in the chat. Any chance that WIC could ever be available through Connect? We know that right now Connect has SNAP, child care, KTAP, Medicaid. Am I missing anything?
That's it. So it is our plan. You know, I'm hoping it's more of a short term than a long term plan to also have WIC on the Connect portal. You know, so WIC is income based, as you know, all of our public assistance programs are. But with WIC, you have to do like a nutritional risk assessment. But certainly we could work out that functionality with the Department for Public Health. Usually a nutritionist, a dietitian does that determination. So yes, you know, that is our plan to have WIC on the Connect portal.
And ARPA may have made that a little easier with some permanent modernizations to WIC, right? There's
funding, I think, for modernization. So
they changed some of the in-person requirements, which I think should help.
Mm-hmm. Any other questions?
I don't see any other questions in the chat. Have I missed anything? You know, I think if people do have questions, feel free to continue to put them in the chat, and we will be sharing the chat as well as any additional answers we need to collect after as part of our follow-up. So just be aware that you'll get all of that information. And I think that we can probably move on to our last item, which is about access to vaccinations and just an update on the COVID-19 vaccination. So I know that there's just a lot happening on the vaccine front. During our last forum in February, just 3 months ago, there was a national shortage of the COVID-19 vaccines. The rollout was really just getting started, and demand was incredibly high. But, you know, we had this strong start out of the gate. We really seemed to hit a plateau in April, and now we find ourselves with the opposite problem, which is that we have much more supply than demand, unfortunately. And I think it's going to be, you know, sort of an uphill battle to get to that herd immunity that we know we need, which is, I think, about 3,375,000, something like that, Kentuckians. So not quite twice where we're at right now, which is about 40% of our population vaccinated. We also know that the administration of vaccines hasn't been equitable for all Black and Brown Kentuckians in a number of ways. I think in particular because scheduling in the beginning was almost exclusively online. There were many transportation challenges. There was also a delay in getting the vaccine to correctional facilities and to other congregate living settings like shelters. And then sort of on the other side of the spectrum, we have the issue of some Kentuckians, particularly those in rural and conservative areas, being more reluctant to get the vaccine at all. So I know over the past few months, the cabinet has been working really hard to dispel myths and promote the safety of COVID-19 vaccines through trusted messengers. There's been a lot of targeted efforts in communities to make sure that there is transportation assistance, mobile clinics, incentives. And so we'd really like to just hear what's happening right now, what we need to be aware of, and how advocates can help. And Carrie, I think I saw that Vivian had to leave, so I'm not sure.
Yes, so Mark Carter's supposed to be on here. Is Mark?
He also, at the last minute, couldn't join us. And I think he thought that Vivian was going to answer some of those questions. So if we need to, we can also do this.
We can talk a little bit.
We can talk a little bit about it, but I apologize. So sorry for that. So Lisa?
Well, I mean, on the Medicaid side, what we're doing, definitely we have reached out to our non-emergency medical transportation providers and told them that we have instructed them that Medicaid members should be transported to any vaccine site, whether if it's a clinic or if it's a drive-through or wherever, they need to be transported. We're working with their managed care organizations. They're doing some very specific targeted outreach in some communities. Still working with them on that to get all of the specifics. But we are allowing them, we're waiving a few penalties for their encounters, that they submit encounter claims. And there's a few penalties that we waived for them so that we can use that funding specific for outreach. They're looking for some incentives, and some of the policies and the processes that they're looking at will actually benefit more communities, not just the Medicaid members in those communities. So allowing them to use those funds, for example, to set up a clinic will allow them to reach more individuals in the community. So that's some of the things that we're doing for the Medicaid population. And we do believe that it's going to spill over into those communities that we're trying to reach.
And then Dale and their home delivery. Dale has focused on individuals who are signed up for meal deliveries. They have made opportunities for them to ensure that they have access to vaccines. We created a vaccine equity task force for that task force to come together and concentrate on those that are harder to reach, and to make sure that they are our focus and that we get them access to vaccine availability.
The CMS too, the Center for Medicare and Medicaid Services, is offering a free webinar specifically about communications for individuals who have vaccine hesitancy. Mm-hmm. So we have our Office of Communications has registered for that CMS webinar, and they're going to be providing specific information that we can use and we can tailor to Kentucky and get out into the public too, to address some of those hesitancy issues.
Yeah, that's really helpful. If that's information that you want to share and if we can help distribute it, let us know. One question that I see here in the chat is related to assistance for individuals who don't qualify for Medicaid transportation. Commissioner Lee, I think you said something to the effect that some of the incentives or some of the assistance could be provided to those who aren't necessarily Medicaid members. Can you kind of expand on that?
Well, that's for example, if the MCOs come together and they create a clinic in a specific community, individuals who come to those clinics, those vaccine clinics, can get that vaccine whether or not they are enrolled in the Medicaid program. But the transportation, I think that would have to be worked out. There's another effort over in the Department for Public Health related to transportation for those individuals who are not Medicaid eligible.
Okay, yeah, and that transportation assistance, I know that I don't have the number off the top of my head, maybe Kelly can pop it in the chat, but there is an 800 number hotline that people can call and get either transportation assistance that, you know, isn't necessarily through NEMT, that Medicaid non-medical transportation, or if you are Medicaid eligible, you can get the transportation through NEMT. And that's also information that we've been trying to pull together from websites and get out to more individuals. I think many Kentuckians with Medicaid are just unaware of NEMT as a benefit or don't know if they, you know, are eligible for it. So that's information we've been trying to get out. There was something else in the chat. Hopefully that answered your question, America. If it didn't, let us know. You're free to unmute if you'd rather just ask it. I also saw a comment from Jackie that she thinks it's really important to share the vaccine hesitancy information. I think that messaging guidance that you were talking about, because there are just a lot of people that they're working with who are very reluctant to get the vaccine, very afraid. So yeah, we'd love to help distribute that if that's something that you have tailored. And an additional question that we had was about the status of vaccines being available for children. I just saw in the news yesterday that soon vaccines should be opened up for children 12 and up. And I'm wondering what that looks like in Kentucky, and also if you've heard anything about children of younger ages.
Information on that.
I mean, we'll have to get with public health, Emily, and respond back. So
yeah, I figured some of these questions we can just do follow up.
Right, if you could just email us, yes.
No problem. And then something else that I have talked with, I think both of you about probably, is what the cabinet is doing to ensure that Kentuckians know that the vaccine is free of charge for everyone, regardless of insurance or immigration status. There's a lot of good information on the governor's vaccine webpage about this, but I don't think that it's always getting out to communities. And when you go to a vaccine site, or when you go to, you know, schedule your vaccine, the message that is loud and clear is bring your ID, bring your photo ID, and bring your number. And so that's one of the things that I think has been a barrier for a lot of folks. I mean, if you think about people who, you know, are less likely to vote because they don't have a photo ID, this is kind of in the same vein.
So about outreach too.
Outreach. I know that we worked with you all on outreach. You know, we updated the flyers, we updated the FAQs. And it was my understanding that public health was going to get that out to the providers as well, you know, the vaccine providers, so.
Okay. It may be that some things have been updated, you know, with vaccine providers that we haven't necessarily gotten, you know, word of.
I mean, as you know, once we send it to them, you know, that they may or may not post it, or yes. So.
Right. Well, and just for everyone who is on the webinar today, to reiterate this message, you know, and make sure that people in your communities, people you serve, know this information. You don't have to have a photo ID. You could have something like a, you know, a utility bill.
A utility bill, right.
You also don't have to have health insurance, even though it is the right of the vaccine provider to request it, because they can bill for the administration of the vaccine if you don't have it, the federal government does pay the bill. And this is true regardless of immigration status. And that's information that we've been trying to get out there. So if you'd like more resources there, we have some good national resources like flyers that we can share with you. So are there other questions that people have related to vaccines or anything else? We have a few minutes left. If there are any other topics that you wanted to kind of get a little bit more information on before we wrap up.
I think Kelly put a link. Thank you, Kelly, for putting that link in there to the CMS webinar that's going to be held. So it is in the link.
Yeah, and I guess not a question, but one thing that we would encourage, we saw that West Virginia is giving out incentives like using ARPA money, the American Rescue Plan funding, to provide $100 savings bonds to younger West Virginians. And if that's something that can happen in Kentucky, I think that that could really go a long way in getting people who are kind of on the fence about being vaccinated to make that step.
So, you know, we'll ask public health, you know, if they're thinking about offering incentives to get people vaccinated as well, and happy to share that information with you.
And the MCOs, we have been having conversations with the MCOs about incentives and what does that look like. And a lot of it, Emily, too, sometimes because we've been looking at the vaccine registry and the information that's coming in. So, you know, how do you identify those individuals and how do you give an incentive to one now when somebody has already had a vaccine? How do you be, and how are you fair to those? But one of the issues that we are looking at is some of our information on our vaccine registry is not as accurate as we need it to be. We have a few records that we can't identify based on the information that was input into the vaccine registry. We can't identify those individuals, but definitely for those that we can. I think the MCOs are definitely looking at incentives for their population.
Okay. Yeah, no, that's all really good information to have. And you know, any additional information you can get from public health as a follow-up would be great. We'll make sure to get it out to this group. And unless there are other questions, it doesn't look like we have any, just a lot of enthusiasm for all of the work that y'all are doing to promote vaccinations and also this health equity work. It seems like there's just so much going on right now. Whatever we can do to be supportive of that work and also get the word out, please let us know. So I think we can wrap up a few minutes early. We really appreciate everyone from the cabinet for joining us today and all of our attendees. So we'll be following up, like I said, with the recording, the slides, the chat, and the ARPA materials and anything else that we discussed today that people have put in the chat. We'll make sure you get as links that you can go to. So thanks again. We will have an evaluation for our forum that will be in August. And we would love to get you know, ideas for topics and other information that you'd like to receive on that forum. So thanks everybody. Have a good afternoon.
Thank you all.
Thank you. Bye-bye.
Bye-bye.